Hello, everyone, and welcome to Chapter 2, Mechanisms of Health and Disease. So the goals of this chapter are to provide a context for understanding why it is so important to understand anatomy, physiology, kinesiology, biomechanics, and pathology of the human body. And I've heard a lot of beginning massage therapists ask, why do I have to know all of this stuff? I just want to work in a spa. I'm going to be doing salt scrubs and just helping people with general stress. Why do I need to know all of this stuff about the body? Well, you want to be able to explain the benefits of massage in an intelligent manner, number one. You want to be knowledgeable in your career field for sure. And when your client has a question about their body and the mechanisms of massage and how the massage is going to affect them, not only do you want to give them an intelligent answer, you want to give them an honest one and not just make something up, which could be very potentially dangerous to your client, not to mention to your licensure. You need to know the mechanisms of the human body, the biomechanics, the kinesiology, in order to do an effective massage, even if it is a stress release only massage, even if it is only effleurage, basic Swedish movements, and you're just giving them a relaxing time. You need to be aware of skin conditions, which is in pathology. You need to be aware of potential diseases that your client has. You need to be aware of which way the joints move comfortably. That's kinesiology, in order to position them properly on the table. You need to know which way the muscle fibers lay. All right, that's the anatomy and how the muscles work to move the body, physiology, in order to put your massage strokes in the correct positions, going in the correct direction with the proper pressure going in the correct direction. All of this is important for you, and all of it works together for the overall mechanisms of health within the human body and how massage affects your client. All right, so we're going to cover homeostasis. And remember from chapter 1 that homeostasis is the relatively constant internal body state maintained by the physiology of the body. You have regulatory mechanisms that are constantly adjusting and adapting to keep our body's temperature and chemical composition in balance, all inside of our internal fluid environment. When that balance is interrupted, homeostasis is altered and the body is more susceptible to a disease process. Now, some of the things that we need to make sure that we understand are stress and health and adaptive capacity. So stress is defined as any stimulus, internal or external, that creates an imbalance in the internal environment. When we are exposed to stress, certain mechanisms attempt to counteract the responses to that stress and bring the conditions back into balance. So if a person is exposed to stress, they respond even before you have any awareness of the stress and tries to bring the body back into a balanced state or homeostasis. When you do this quickly, it is called adaptation. If adaptation does not occur, homeostasis is lost and dysfunction results. The ability to adapt is called adaptive capacity. Health can be described as the effectiveness of the body's ability to maintain homeostasis and a strong adaptive capacity. Dysfunction and disease can happen when the adaptive capacity is diminished. So the more healthy you are, the more ability you have with your adaptive capacity. So adaptive capacity can be diminished by too great of a demand to adapt. For example, you're involved in a car accident and a loved one is injured and you are incredibly depressed by this event. You have an insufficient ability to adapt because of poor nutrition, sleep disturbances, and other negative factors. Dysfunction in the body's organ systems, such as an inability to make the hormone insulin or to regulate it correctly, such as in diabetes or insulin-resistant PCOS. Interventions that can support a return to health are things like reducing the demands, reducing the stress, making healthy lifestyle changes, and using medical treatment, either medication or surgery, to replace substances that are lacking or to correct the dysfunction. So, what does adaptive capacity have to do with you as a massage therapist? The state of a client's adaptive capacity determines the category of care for the massage application. There's 4 general categories of care for massage, and they are therapeutic change, condition management, restorative care, and palliative care. So, what's therapeutic change? Clients who have a good quality adaptive capacity are able to respond to the stress of a therapeutic change approach to massage. This is honestly my favorite. The goal is to reverse a current condition from a pathological state to a healthy state. So an example of this is that a massage therapy client has been ill with an upper respiratory infection, and they've been coughing and experiencing difficulty breathing. And as a result, their back, their chest, their shoulders, and neck have all become stiff and tender. It's been 2 weeks since the infection subsided, so it's no longer a contraindication, and they can come into the office. They are healthy, but they still have stiffness in their back, their chest, and shoulders. So you can do specific therapeutic massage interventions to reverse the condition because the client has sufficient adaptive capacity to respond. So you can think of things like gently massaging in between the ribs on those intercostal muscles that have been stretched and stressed by all of the coughing. This is where you need to learn where all of those major back muscle fibers lay and which directions they go to appropriately massage the back in order to bring balance back to those muscles, and how to lengthen and appropriately massage the neck. If the client still had mucus buildup in the lungs, you could even do percussive type motions and tapotement on the thorax in order to break up that mucus and to induce what we call productive cough. That is when they are coughing and actually bringing up mucus. These are all different therapeutic interventions that you can do as a massage therapist to help them recover and get back to homeostasis even quicker. The next type of massage care plan with adaptive capacity is condition management. If a massage client has a reduced adaptive capacity, then the category of care is called condition management. The massage application does not attempt to fully reverse the condition, but rather targets more general outcomes that support sleep and stress management. Specific therapeutic massage intervention is minimal and targeted to the client's most aggravating symptoms. This is going to be the general population that comes into a private office that offers general Swedish massage, or possibly even into a spa. They're going to tell you that they have 1 or 2 issues, but it's not really something that they want you to target deeply or that they're concerned about curing. So an example of this would be a client who smokes cigarettes all the time, so they're prone to bronchitis, and they have recurring headaches related to soft tissue changes in the neck and persistent neck and shoulder pain from coughing. The client has a poor to moderate adaptive capacity. The focus of the massage is general and non-specific. Specific intervention will target the most troubling symptom being experienced during that session. So this client may even have Raynaud's syndrome. They may feel cold because they have constricted blood vessels, especially in their hands and feet. So you're going to want to use extra blankets if they request it. You're going to use lengthening strokes on the neck to release that neck pain. Work on those suboccipitals to work on those recurring headaches. With all of that smoking and the headaches, they also may want to consider some water intake, but be careful about telling them to drink water. You can tell them what you would do in the situation, but you are not a prescribing physician. Do not tell them what to do. You can make suggestions or tell them what you would do so that they could infer what they should be doing. If they're going to continue to smoke and continue to get sick, you can continue to work on those intercostal muscles and the back and neck muscles to help them out. But this is not something that you're going to help restore completely in this client. A restorative care approach to massage helps the body to return to a state of calm and allows it to relax and repair itself. The client is already generally healthy and has adaptive capacity. This care approach can be considered preventative and part of a health maintenance. You will see this a lot of times in fitness facilities where they are not complaining about an overstretched muscle, and also in the spa environment. An ongoing weekly or bi-weekly appointment schedule is recommended usually for preventative maintenance, and regular functional assessment monitors for indication of reduced adaptive capacity and minimal interventions are used to restore function. So, for an example, a client has a mentally demanding occupation and they also jog and they bike regularly. The client understands the importance of ongoing self-care and health maintenance. Receiving massage every other week supports a healthy lifestyle. They might have a few tweaks here and there, but they are looking for general stress reduction and to keep themselves limber and loose to prevent future injury. If the client's adaptive capacity is significantly reduced or non-existent, the approach to care is palliative. Palliative meaning pain relieving. The goal of palliative care is to create pleasing sensations to reduce discomfort, but without any expectation of improvement other than symptom management. For an example, a client is recovering from pneumonia. They've been super ill, and in just the past few days, they have finally been able to breathe without supportive oxygen. They are stiff and aching from extended immobility. Their adaptive capacity at this time is minimal. The category of care is palliative. The client enjoys having their feet and shoulders massaged, and this is the plan for the massage. They're currently in too much pain, and their muscles are still too tender from being immobile and all of the coughing to really work on the thorax deeply. They don't have the adaptive capacity. Their body is still healing and unable to get any benefit from actual therapeutic change in those regions. You want to reduce their symptoms a little bit, and you want to give them a pleasing sensation elsewhere. So you're going to work on their shoulders, which will help some of that stiffness and soreness from the coughing, but also from the feet, from general body relaxation. And absolutely, of course, you can incorporate things like acupressure and reflexology in these regions to affect a healthy therapeutic change in the thorax. Your book very lightly covers the 5-element wheel, the Asian 5-element theory, Ayurvedic theories, chakras, and other Eastern medicine. I have included some of that information in your assignments. It barely scratches the surface, especially considering these theories have been around for thousands of years longer than the Western world's concept of massage therapy and Swedish massage. I highly recommend that if you are interested in these modalities and in these theories of thought, to take a continuing education course at some point. You can actually even attend schools to get degrees and certifications in these. But we are not covering them deeply in this chapter. It just simply does not do them justice. Now, I have included some introductory videos for you. In addition to your assignments, I will have them in the extra resources this week. And you can look them over there if that is something that you are interested in. It is not deeply covered on your MBLEX. And working in the United States, it is a very small percentage of your clientele that is going to be looking for that type of work. And it certainly deserves much more information than what we have available to you here. Since it is not part of your testing protocol, We're not going to spend a ton of time on it. It does not affect working with a hospital or a chiropractor, although you may need to be versed in this if you want to work with a holistic doctor, any type of holistic practitioner. So just please be aware of that. And if you're interested, by all means, if there's something that I haven't provided for you in the extra resources, or if you have questions about, let me know and I will absolutely try to get that for you. While we aren't rehashing homeostasis in deep detail from chapter 1, one thing that we do need to cover is a feedback loop. Every system in the body contributes to maintaining homeostasis, but especially the nervous and endocrine systems are the most important. Nerve impulses and chemical messengers transmit information needed to maintain homeostasis through what we call feedback loops. Every feedback loop is made up of 3 components. There's a sensor mechanism that responds to the change in homeostasis. This change is referred to as a stimulus. The sensor usually creates an electrical or chemical signal. Believe it or not, your nervous system uses both electrical and chemical signals, whereas the endocrine system is primarily chemical. The other component is an integration or control center that analyzes and integrates all signals received and, if necessary, initiates a response in the body. The third component in your feedback loop is an effector mechanism that responds to information from the control center and then creates a change to bring back homeostasis to the body. Now, there are 2 directional terms with this that you need to know. There is afferent and efferent. They're used to describe the movement of a signal from a sensor to an integrating or control center, or in reverse, the movement of a signal from the control center to some type of effector mechanism. Afferent with an A means that the signal is traveling towards a particular center point of reference. Efferent means that a signal is traveling away from a particular center or point of reference. Effectors are the various organs of the body that can reestablish homeostasis by changing the hormone balance, blood flow, breathing rate, and so forth. The term negative feedback refers to the feedback that reverses the original stimulus, stabilizing physiological function and helping us maintain our constant internal environment, homeostasis. The term positive feedback enhances the original stimulus and thus maintains or accelerates a disturbed state of homeostasis. Therefore, the purpose of a positive feedback is not to maintain a stable internal environment, but rather to continue the disturbed state of homeostasis until something outside of the loop stops it. The contractions that occur during labor and delivery of a baby are an example of a positive feedback loop. Owing to the release of certain hormones, the contractions become stronger and stronger until the baby is born. The birth of the baby is what eventually stops the feedback loop. Another example of a positive feedback loop is the way the body responds to invading pathogens. Pathogens are disease-causing organisms. The body's immune system has specialized cells called lymphocytes that respond to these pathogens. And as a result of the release of certain hormones and chemicals by body tissues, lymphocytes know how to attack the pathogens. The lymphocytes stimulate even more lymphocytes in a positive feedback loop to respond and attack the pathogens. This buildup of lymphocytes, again, is a positive feedback loop that continues until the infection is contained. It's the containment of those pathogens that eventually stops the feedback loop. Now, one thing that is really important to remember in massage therapy is some continuing positive feedback loops may become harmful if the loop does not cease when the cycle no longer serves a purpose. An example of this is a muscle spasm that causes pain, which results in an increased spasm. This is referred to as the pain, spasm, pain cycle. I cannot even count how many clients have come to me for therapeutic change that are in a pain, spasm, pain cycle. Pain creates a protective spasm, which in turn increases the pain. The cycle continues until some sort of intervention, such as massage therapy, stops it. In the cases of this, I like to use things such as ice, which is an extreme temperature difference that your nervous system has to pay attention to. That helps stop the pain, spasm, pain cycle. Trigger point therapy or deeper pressure, holding the muscle in place are all things that the nervous system is now paying attention to and dividing its interest and can help stop this pain, spasm, pain cycle. So your book also covers in chapter 2 something called chronobiology a little bit, although they don't call it chronobiology. Chronobiology is a field of biology that examines timing processes, including periodic or cyclic phenomena in living organisms, such as their adaptation to solar and lunar-related rhythms. These cycles are known as biological rhythms. Now, the biological rhythms, according to your book, are the internal periodic timing components of an organism that are generated within the body. The 3 that your book are concerned about are circadian rhythms, which work in a 24-hour period to coordinate internal functions such as sleep. Ultradian rhythms, which repeat themselves every 90 minutes to every few hours or so, such as endocrine function and temperature regulation, according to Western medicine. In Eastern medicine, each of these rhythms are tied to a specific area or function of the body and to a specific meridian. Seasonal rhythms are annual functions, such as feeling more alert in the spring and wanting more sleep in the winter. And some forms of depressive disorders, as well as many sleep, neurologic, cardiovascular, and endocrine disorders, have recently been associated with dysfunctions of the body's biological rhythms. One thing that you may hear of, especially living in Michigan and closer to the far north, is something like SAD, like seasonal affective disorder, where people just simply aren't getting enough sunlight, which can make them depressed. SAD, haha. It is an acronym and a fact. Something that's pretty cool is that biological rhythms can be affected by rhythms of music, by repetitive sounds, things like a bubbling brook or a breeze in the trees, visual patterns. Think of strobe lights. Think of trance music, repetitive bass in music versus a repetitive underlying rhythm in classical music. Chaotic or abrupt noise can be a disruptive factor, like someone suddenly screaming or pots banging. Whereas surf sounds, like the ocean's breaking waves, and similar nature sounds usually have a calming effect. Studies have shown that the rhythmic psychological patterns of a dog or cat's breathing or heart rate can benefit elderly people. The rhythmic and ordered approach used in massage and bodywork methods seems to have effects similar to those just described, especially when the methods are provided by a calm and focused practitioner. The length of application seems to be important as well. A session that lasts between 45 and 90 minutes falls within the ultradian rhythm pattern. So this works well within the natural balances of the body. So you can imagine that calming, repetitive, rhythmic music during a Swedish massage application could have exceptionally relaxing effects on the body. I would like you to refer to your PowerPoint, your chapter, and your assignments for some of the next information in the chapter where it is talking about pathologies, inflammatory disease, and different types of pain, such as acute pain, chronic pain, neuropathic pain, neuroplastic pain, mixed pain. There's multiple types of pain. These are also covered in some detail in your assignments, so please pay good attention to those. Now, one thing that you really need to understand as a massage therapist is pain threshold and pain tolerance. Now, pain can be brought on by mechanical means, electrical means, thermal, or chemical stimuli. We don't adapt to pain or accommodate it well And that's a good thing, because pain is a warning system that something is wrong in the body. We need to have pain to let us know. Those who are unable to experience pain are in real danger of injuring themselves and not knowing it. So what's a pain threshold? A pain threshold occurs when a stimulation becomes intense enough to initiate the firing of pain receptors within the body. Generally, human beings all have about the same threshold for pain, but you will hear people state, oh, I have a high threshold, or some people get overstimulated very quickly. People with neurological conditions tend to fall into these categories. Those with fibromyalgia and even autism, where they experience sensations in a different manner, or have pain receptors that seem to fire a little bit more quickly. They're a little bit more sensitive. They will have what we call a lower pain threshold. People with ADHD or have been chronically burned or something and have either physically less pain receptors due to mechanical injury in the past or due to a different firing system, or rather I should say an injury to their firing system or a disruption in their firing system, they will state that they have a higher pain threshold. Pain tolerance is the response to pain, and that varies considerably and is influenced by cultural and physiological factors. Pain tolerance is modified by age, emotional, and mental states. So their physical threshold is usually about the same, unless they have mechanical disruptions to their actual pain receptors. How they tolerate the pain, how they react to the pain, is usually very subjective from client to client. The intensity and pressure and depth that you use for one client during massage will absolutely be different for every other client that comes in. And the pressure and intensity that you used in one session, you might not be able to use in the next session because their pain tolerance may be different due to their emotional state, due to physiological changes. Perhaps they're recovering from a cold. Maybe one day they just had a hot bath right before they came in, or went to the gym and their body was warmed up and now they're not. Perhaps one day they took ibuprofen or aspirin before they came in, or a muscle relaxant, and now their body has a physiological change, including the ability of their pain receptors to feel the pain. So their pain tolerance is going to be different every single time. Subjective measurements of the intensity of pain are more reliable than observable measurements, okay? So you're going to want to ask them where they feel the pain, how strong the pain is, rather than just watching their face for a grimace. Or in one case, I had a client that would come in frequently with severe back pain, and he would tell me, just work on me until I start getting the pain sweats. He had a very high pain tolerance, but then when it got really bad, he would literally start sweating. And when he started sweating, that was my physiological cue to stop that type of deep pressure with him. That's what he requested. We were working on a very specific back problem that we were trying to get resolved in a shorter than normal period of time. This is not something that I would recommend to beginner therapists. And absolutely the way that we went about it was only because he had been my client for a very long period of time, and I both knew his body signals very well, and he trusted me as a therapist. You are never going to work on a new client and just wait until they start sweating to determine if they are in pain or not. Of course, there are many types of pain management. We just sort of use that phrase to describe all types of healthcare services for pain. This could be a terminal or palliative care, where you're just trying to relieve the pain. You're not going to be able to make any therapeutic change in this pain. People that have acute pain, it's a sudden onset of pain and will not last very long. That is acute pain. Or chronic pain management, which chronic pain lasts for a significant period of time, months, up to years or possibly their entire life. Now, there is transcutaneous electrical nerve stimulation, such as using a TENS unit. Those are pretty cool, and those are electrodes attached to a small portable unit that stimulate the skin surface over an area of pain. This will, of course, affect dermatomes. We will be covering dermatomes. There is acupuncture and acupressure. There is a placebo response. There's distraction and imagery. Distraction is focusing the attention on stimuli other than the pain. And imagery consists of using the imagination to create or remember a mental picture that is relaxing and relieves the pain. So we're basically ignoring the problem and imagining something else to try to make the pain go away, which is actually pretty effective because your mind is what makes your reality. There's biofeedback mechanisms. There are aromatherapy, using essential oils, which are the lipid extracts from various parts of plants. And they can penetrate the skin pretty quickly to provide an analgesic or pain-relieving effect. And there's also the olfactory nerves, links to part of the brain that involve emotions and endocrine function. So when you smell, your sense of smell, olfaction, these aromas can have profound effects on the mind and emotions. The essential oils can be used as compresses. You can use them for inhalation, or put them in your massage oils. Of course, music therapy, we've already talked about how that affects your biological rhythms. It can also affect your pain. There's hypnosis, there's heat, there's cold therapy, which I absolutely love. Ice massage and cold therapy is amazing. It relieves pain by reducing swelling through vasoconstriction, decreasing stimulation of pain nerve endings, and also by stimulating the release of opioids within the body. Obviously, massage has an analgesic effect. And of course, there is medical treatment as well. Another thing that you're going to cover in your assignments that is in Chapter 2 and also in your PowerPoint is stress, the important factors in stress management, resilience, which is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family, relationship problems, serious health problems, or workplace and financial stressors. I mean, I think all of us could use some more resilience at this point. Absolutely. Now, there's a little bit about life cycle and the aging process in your chapter I would like you to take a peek at. And there is a little blurb about health education, resources, and the massage therapist's responsibility that is also covered in Chapter 2. The terms massage and massage therapy do not mean the same thing, and this is an important concept to remember. There are important distinctions explaining massage as a patterned and planned soft tissue manipulation, and massage therapy as a more complex therapeutic interaction that includes elements of health education and messaging about health, therapeutic relationships, such as wanting to integrate in palliative care or therapeutic change, direct communication with your client or patient, and therapeutic context. Massage therapy consists of the application of massage as well as the non-hands-on components of a therapeutic interaction, including health promotion and educational messages for self-care and health maintenance. Now, you absolutely need to know the things we began discussing at the beginning of this lecture. You need to know anatomy, physiology, kinesiology, biomechanics, pathology, all of these things to be able to promote health and educational messaging for self-care for your clients. Massage therapists often work with retention-based clients. That means clients seen on a regular basis. This is known as your income. You want these clients to return, okay? You will be allowing this time for reinforcement of health promotion messages to these clients. And it's important for therapists to make sure that they are giving correct, evidence-based information and to stay within their scope of practice. Massage therapists can include information about evidence-informed, beneficial lifestyle behaviors in the massage session. This information should be general and informative, but not prescriptive. Remember, this is where I told you, you can tell them what you would do in this situation or what best practices are or what you have read during research, but you cannot say, hey, you have to do this stretch and drink 3 glasses of water and take an ibuprofen. You are not a health care professional that is allowed to make prescriptive statements or a diagnosis that is not within your scope of practice. But you definitely need to be well educated in the therapeutic change that massage can bring about and best practices for your clients' self-care.